to share.
Hello everyone, welcome. Just going to give people a few more seconds to join.
You got my screen up.
You stop sharing and then you can get your presentation up there, Julie.
Yeah, okay.
Perfect. Okay. Just going to admit the last few here and then we'll begin. Perfect, right. Okay. Welcome all. Thank you for joining our webinar from the Exploring Eczema webinar series. Today we'll be learning about emollients. I'm Eleanor Martin. I'm the Health Content Lead here at the National Eczema Society, and today I'm joined by Julie van Onselen, our lead speaker for our Exploring Eczema webinar series. National Eczema Society is a UK charity that provides support and advice for people affected by eczema and their support systems. Alongside our wide range of information and advice about eczema, we use our collective voice to raise awareness of eczema, progress research, and campaign for better care. We've been working to make life better for those living with eczema for over 40 years, and we rely on voluntary donations to fund our work. Just a heads up, we will be recording today's session, so you'll be able to watch back afterwards, but not to worry, all participants' microphones will be muted and cameras will be switched off. Please do change your screen names to anonymous if you don't wish for your name to be visible in the recording. There will be an opportunity to ask questions at the end. You'll be able to do this by using the Q&A chat feature. Feel free to drop questions in there throughout the presentation and we'll aim to answer as many as we can at the end of the session. We have more webinar sessions coming up shortly, but I'll speak more about those at the end of the presentation. So without further ado, I'm going to introduce our lead speaker. Welcome, Julie. Julie has worked with the National Eczema Society as a clinical nurse advisor for over 20 years, providing support to thousands of members of the eczema community. She also has an impressive 30 years of experience caring for those with eczema in the NHS. Over to you, Julie.
Thank you very much for your kind introduction, Eleanor, and thank you to everybody for joining today. I really hope that you get good information from this webinar and you find it interesting. Please feel free to add questions as we go. I will speak for about 30 minutes, but there will be adequate time to answer as many of your questions as possible. If we get a lot of questions, we won't be able to answer every single one, but Eleanor will coordinate them and we will group them together and hopefully everything will be more or less answered. So it's lovely for you to join us today at the Exploring Eczema webinar series. This is the second of the series, and today we're going to focus on emollients. So as my audience, I'm imagining you have eczema yourself. It may be something new, or you may have had eczema for many years. You may be a parent caring for your child or children with eczema. You may be a carer yourself, caring for maybe older relatives with eczema or caring for your family generally, or you may even be a healthcare professional as well. So you're all incredibly welcome. It's really useful to explore emollients as a standalone topic because they really are the absolute first-line therapy for all eczema. So just let me move on to the next slide. That's me. So what are we going to cover in this website? Well, as I said, there's a lovely expression, complete emollient therapy. I'll explain that in more detail, but it basically means that emollients should be used as your first line management or therapy for eczema, and complete means they should be used for washing and moisturising and be part of your daily routine. So what are we going to discuss? We're going to look at ingredients of emollients because, as you know, emollients really differ. And in that way, we'll follow on and we'll look a little bit more about how emollients work, but what types of emollients are also available. Just to say, I'm not going to necessarily speak in brands or product names, although I am happy to give examples. If you want a really good list of emollients and their actions, and the 3 actions I'll talk about today and which of the branded emollients fit into those actions, you can do no better than go to the NES website and download the emollient fact sheet. But we are going to talk very practically about what emollients need to do, how they work with the skin barrier. And we do know that people with eczema, at least 50%, have a skin barrier that needs to really be looked after for life, because if you don't use emollients and you don't constantly repair your skin barrier, this is going to make your eczema possibly flare again. We'll look at how to apply, and we'll also look at some safety issues as well. So whenever I put these webinars together, I always think, let me think of the questions that you as an audience might be thinking about, you as the audience might want to ask. So, of course, even the terminology, what's an emollient, what's a moisturizer, can be confusing. So what are emollients? And $1,000,001 question that I'm always asked is, so what is the best emollient? What's the best emollient for me? What's the best emollient to prescribe? That's a tricky one. There really isn't a straightforward answer, because actually the best emollient is the one that suits you and your skin. But when are they used? And also, when are they used perhaps in conjunction with other treatments? How are they applied? And can any emollient be prescribed? And I'm sure we might get some questions about emollients that perhaps you have having some issues with being prescribed. So hopefully we can clear up some of those things for you in the webinar. So let's start with the first question: what are emollients? Now, this slide of brands is a little bit old, although what it's only demonstrating is there are many different emollients, but as well as medical emollients, because we use the terminology emollient, and an emollient really, in terms of what it means, really means to soften and soothe the skin. And medical emollients are very different to cosmetic moisturisers, because obviously there's a range of other moisturisers out there, which often contain perfumes which are cosmetic. So a medical emollient is bland, it's unperfumed, and it doesn't have any anti-aging ingredients as well. So that's really important, that we're looking at these bland medical moisturisers, which we call emollients, and they're very important. And they should be a daily therapy. So really with emollients, they should be used day in, day out. And the reason is that we need to keep softening and moisturizing and protecting the skin, and most importantly, repairing the skin barrier. It is really difficult to get on top of eczema if your skin is not well moisturized, and moisturizers are your ongoing daily treatment. And other treatments where you're treating active eczema should always be short term, but emollients should always be long term. So some emollients actually contain active ingredients. So when we say active, some have an ingredient added to them. So most emollients, and we'll talk about the different formulations, so whether they be ointment based, which is mainly paraffin based, or whether they be creams, which is a mixture of paraffins and water. And some emollients can be very bland and not necessarily have an active ingredient, because they're just emollient ingredients. But some emollients also contain active ingredients. So I think it's important to just go through, in terms of the range of emollient, and when you maybe see an ingredient in emollient, to know which ingredients could be very helpful to you. Of course, sometimes an ingredient can irritate and not be so helpful. So the first thing is, there are a range of emollients we call humectants, and humectant emollients basically contain natural moisturising factors. So natural moisturising factors, and there are just 3 examples here, are complex entities that are within the skin normally. So when you have eczema, you actually have 80% less natural moisturising factors. And this obviously links with the alteration in the filaggrin gene, which basically means the eczema's skin barrier is much more vulnerable and not as robust and resistant. Again, we've got a diagram coming up next to demonstrate that. So these emollients contain humectants, an active ingredient. Urea is a humectant, but it's also a keratolytic, so that's quite useful if skin is very dry. Now, there are a few brand names mentioned, and that's just to give you a guide to where these emollients sit. So the other next ingredient we could talk about is antimicrobial. So some emollients also have an antimicrobial. So this is not an antibiotic, so you don't get resistance. But what it does is it's more of an antiseptic ingredient, and that certainly helps reduce bacteria on the skin. So again, people with eczema have a lot more staphylococcus, which is a common bacteria that we all have on all of our skins. It's known as the microbiome. But in eczema, there's a bigger population. So sometimes if you have very severe eczema or you have infections, it's quite useful sometimes to wash or apply an antimicrobial to try and reduce the Staph aureus. Now, some emollients contain extra antipyretic. Pruritus means itching, but certainly I would say every emollient is an antipyretic. Every emollient helps with itch. Every emollient is your first line defense with itch. But there are some, lacromacrogols is a topical anesthetic, and menthol emollients are very soothing. And they can also be kept in the fridge, and they can be very cool and very soothing. So that's a useful ingredient as well. And then there is one emollient that contains an anti-inflammatory ingredient, which is quite interesting because that's quite useful to use when the eczema flare maybe has subsided. You want to stop using your steroids and keep your steroids as your short-term treatment, and an anti-inflammatory may be useful for you. Saying that, choosing an emollient with active ingredients, it's important to know what's in your own emollient pot. So you need to look at the emollients you have. If you're not sure, we can certainly answer questions later. But, just see, is there an active ingredient? Is that helping me or is it not helping me? And as I say, when we talk about the skin barrier, that's very important as well. So when somebody doesn't have eczema, we'd like to say the skin barrier is much more akin to a cement wall. So think of a nice, robust cement wall. You've got nice, even bricks. Just standing in a line. In between the bricks, you've got nice cement, which is robust and is not letting anything through the wall or into the wall. And what you have got is a really nice, robust barrier. So that means that when you don't have eczema, you can keep moisture within the cells, and with normal skin, the moisture is kept in the cells with the natural humectant factors. But more importantly, irritants and allergens can't enter into the skin. Now, the problem is, and we do know that at least 50% of people with eczema have that filaggrin deficit, which is a gene deficit, which alters some important factors in the skin called proteases, and actually makes the skin much less robust. So what it means is that the cells, the corneocyte cells, they just cannot hold water effectively. So the cells are uneven. They have gaps in between. The lipid lamellae, which is in effect the cement around the bricks, crumbles and cracks, and again isn't holding the cells together. So what you've got is, because of this genetic disposition, you often have a defective skin barrier, and this is defective for life. Of course, people with normal skin can have defective skin barriers at certain times in their life if they maybe have a skin infection, or if you do something silly like get sunburnt, you can, but generally that skin barrier will restore. So the whole point is that with eczema, and this is really a really key point about the eczematous skin, that moisture is allowed to escape, and if we keep moisture in the skin, we help the skin cells swell up and retain water to make a very robust barrier. And also irritants can easily enter the skin and then excite the immune system and excite cells called cytokines, and this is what causes the inflammation. And of course, if you scratch your skin, which you can't help because of itching, you damage and break open the skin barrier more. So you have this whole cycle. So this is why emollients in effect are therapeutic treatments and are skin barrier repair therapy. So we've got to try and you really need to get to the point where you are using your emollients every day, sometimes even several times a day, but you've got to find the emollient that suits you and fit it into the routine that is best for you or your child, I should say, or the person you're caring for. So let's forget those brands and pictures of brands because basically, and there are a lot of emollients available for prescription, but saying that, a lot of formularies also restrict the emollients that can be prescribed. But basically, emollients come in three different, formulations is more about whether it's a lotion, cream, or gel, but actions is more about how they occlude the skin. So you've got different formulations, and those formulations have actions which occlude and repair the skin. So you have an occlusive action, and all emollients should have an occlusive action by putting a layer on the skin, so trapping the water in the skin and preventing allergens and irritants from entering the skin. And then, as we've already discussed, some have humectant qualities that add natural moisturising factors and help increase the water in the skin. So a simple occlusive emollient generally is a lotion, cream, or gel because they will just have an occlusion that often will be quite short acting. So if you have a baby with eczema, a simple occlusive emollient, bland emollient that suits that you're applying every nappy change is absolutely perfect. You don't need the emollient to last more than 2 to 3 hours. But if you have a child at school or if you're going to work, you probably like an emollient to last the day. So the good thing with the ones that contain humectants is they last a lot longer, but they're still often as cosmetically acceptable as the creams and gels. So generally they will last 6 to 8 hours, so can be used throughout for the school day. Whereas if you have a simple emollient and you have a school-age child who's got quite moderately severe eczema, you're absolutely going to need to have the child to be able to have a nice safe area to apply the emollient themselves or even help to put it on, which is quite tricky in schools. And we are discussing eczema in schools in another webinar, of course. Now, the thick occlusive are basically your ointments, so you're very grease-based. And grease-based ointments often come in a tub, so that's important. You scoop them out and you don't put fingers in because fingers in tubs can actually sometimes cause the emollient to become infective itself. And sprays and occlusive sprays are very useful, particularly that for people and children maybe who have a sensitivity to touch. You sometimes find that within the autistic spectrum. So it's really, really important because actually how the emollient feels on your skin, how it smells on your skin. And that's the other thing, that emollients can smell quite differently. One emollient can smell differently to another on different people's skin. So basically, you've got to choose a formulation that you will use because you like it, you like the smell, you like the texture, and some people, might like a cream. Some people might love a greasy ointment because they feel their skin's very dry. Sometimes you can actually mix and match, and you could use maybe a cream or a gel in the day, and you could use an ointment at night. So that you can mix and match. The most important thing is that you have a emollient, or for your eczema toolkit, which I talk about a lot, it's quite good to have maybe a range of emollients. Sometimes even seasons. In the hot summer weather, you might prefer a cooling cream or gel that you can keep in the fridge. So there's lots of choice. Lotions are quite watery. They contain much more water than oil, so sometimes they don't completely occlude the eczematous skin. But again, to use as a lighter emollient in between times, that they may have a use for people with more milder eczema. So, as I say, the effect can last a few hours. So this is a great diagram because this shows that just a simple occlusive just occludes on the skin and helps to repair the skin barrier. A thicker occlusive has a much longer action And the occlusive humectants, as well as occluding and repairing the skin barrier, add back natural moisturising factors to the skin barrier, and also kind of help with perhaps a slightly more sophisticated barrier repair. Having said that, all emollients repair the skin barrier effectively if you use them correctly as well, and if you use them. So, but with the simple occlusive, you may need to apply those 3 or 4 times a day. The occlusive humectants maybe twice a day. But if a particular emollient doesn't suit you, then it's important to actually move on to another emollient. And also, the great thing with emollients is you absolutely cannot overuse them. You use the emollient as you want. If you do spread them too thickly, or you spread them in a technique, you can sometimes have something develop called folliculitis, which is sort of blocked skin pores. So we'll go through the technique of applying them to try and reduce that as well. But really, whenever your skin feels dry and itchy, that's a good time to apply your emollient and get into a regular habit of applying an emollient regularly, and also using the emollient for washing with as well. So we want what does the emollient need to do for you? Well, we want it to treat your dry skin and repair the skin barrier. And in that way, itch should be relieved or made a lot better. Emollients really are the first line treatment for itch, not antihistamines. We do use antihistamines in eczema treatment, but generally, if it's a combination of eczema and maybe urticaria, so you'd use antihistamines for urticaria or hives. But we might use sedating antihistamines, particularly maybe to help children with sleep. But generally, your emollient is your tool for the itch. But you want the emollient to have no irritating ingredients or fragrance. Even essential oils can sometimes be problematic and cause problems. And of course, we want the emollient to be cosmetically acceptable. So, a thick grease may be really good at moisturising your skin, but I always say, who wants to go to work or school feeling like a channel swimmer? But there again, under old pajamas at night, if you are very dry and you want to really use the emollient to give you a little bit of a boost, could be quite helpful every so often. So emollients need to treat the dry skin, and that's exactly what they do with this occlusive barrier. You see, the occlusive barrier stops irritants and allergens coming in, and it stops the water coming out. And that's the absolute key feature of emollients and how they actually treat, because with eczema, you've got dry skin, itchy skin, and then of course you've got the red skin with the flares. So dry skin is really important. You repair the skin barrier in the 3 ways I've talked about, with either a simple occlusion or a thicker occlusion, which lasts much longer, or the humectant occlusion, which also has a slightly longer lasting effect. So itch is really relieved with emollients. And of course, we always look at the vicious dry skin itch scratch cycle of eczema. And you all know that, when you have dry skin will always be itchy. If your skin itches, you're going to want to scratch or rub, which actually ends up exciting the cytokines, and it can make the eczema flare. So the idea is to just really try and soothe your skin whenever it's dry, whenever it's itchy, with your emollients. And then in that way, if your skin is itching, you maybe grab a pot of emollient and just literally stroke it on your skin and try and help break the dry skin itch scratch cycle, which can be really tough. And if your skin's flaring, emollients alone won't treat the eczema. So you will need to have a short course of eczema treatment, which will generally be your topical steroid. But it is important that ingredients contain no irritating ingredients. So we talked about perfume and fragrance. They're more or less the same, but remember, sometimes essential oils help fragrance emollients, and occasionally people can also have an allergy to essential oils, particularly the limonene oils, which are sort of the lemon flavors. Now, sodium lauryl sulfate is a big enemy to skin, and this is a detergent which generally is contained within the emollient. So the big culprit to the sodium lauryl sulfate containing emollient was a reasonably priced emollient called Aqueous cream, which is still about. Now, some of you, particularly if you're sort of my sort of age, you may have been told throughout the years, oh, always use aqueous cream to wash with. Now, the reason is it dissolves well in water and it is good for washing, but it's good for washing because it contains detergent, which in effect is what soap and bubble bath does. If you use a detergent to cleanse your skin, even though it appears to be an emollient such as aqueous, you will actually increase the pH of your skin, and increasing the pH of your skin will lead to irritation. It will lead to more skin barrier breakdown and more eczema. So really, we've got to use emollients without sodium lauryl sulfate. And generally, most medical emollients don't contain it, but there are still some sort of generic versions of aqueous cream you see on the shops of pharmacists, shop floors of pharmacists. Now, preservatives is a big thing, and sometimes preservative is referred to as parabens. Paraben is a main preservative used in lots of cosmetics or emollients. And basically, if you've got a cream, a gel, or a lotion, you have to have a preservative in because it's a mixture of water and oil. Otherwise, quite simply, the cream or lotion or oil would go off and it wouldn't have a stable formulation or the, it wouldn't have a good shelf life. So, I think the message is preservatives aren't bad, but sometimes they can be an irritant. So I think the main thing is if your emollient's irritating you, you're not getting onto it with it, you need to simply move on and use something else. Now, children often will say, oh, it stings, it stings. And sometimes when skin is dry and eczema's flared, emollients will sting because it's actually the eczema that's irritating. And maybe if a child has an emollient on when their skin is stinging, they then almost have a perception that every time the emollient goes on, it's going to cause more stinging. So they sort of recoil from it. It's a little bit like you may know of a psychological experience called Pavlov's dog, where a dog is conditioned to an electric shock to stop it wandering. It's the same thing. So I call these children Pavlov's children. A good way to know if your child isn't, if the emollient isn't allergic is to actually just put a little bit on while they're asleep. If it's irritating, they'll move their arm or they'll shuffle around or they'll wake up and say, oh, I don't like that. Obviously frustrating because it takes quite a while to get a child to eczema to sleep. The other thing is just to use it in the bath. So rather than put it on dry skin and actually washing with emollients is absolutely essential. But if you can try emollients within water, that's another good way. Now, cosmetic acceptability is really important. As I say, often, it is thought in dermatology, the drier the skin, the greasier the ointment. But as the years have gone on, I'm really don't believe in that because I think if you have something thick and greasy, you're not going to use it. So if your eczema isn't improving, it's a really good idea to go back to basics and maybe find an emollient that suits you, because actually the emollient that suits you and the one you use for washing and moisturising absolutely will make a difference. You can also, and research has shown this, have longer periods in between flares and longer periods in between having to treat flares. So you need to use an emollient every day. You need to use it several times a day. Always use an emollient when washing. And all the emollients actually can be used as washes as well. So they can be a 2-in-1, apart from the very greasy 50-50, which is just very difficult to wash with. So what you would do is you would apply a layer of emollient before you get into the bath, or a layer of the emollient, and then just shower off. Now, you have to be careful because emollients can be slippery. So I would use a bath mat or a shower mat and just be very aware. But then you literally just stroke downwards and stroke the emollient off as you wash. Now, emollients do absolutely cleanse the skin because I know some people really worry about that. And absolutely, they cleanse as well as anything with soaps or bubbles or detergent in. And also, it's really important to use emollients whenever your skin's feeling itchy. They really are, your first line against dry skin and itch. Applying is really important because you've got to apply your emollient in a soothing way. If you rub, the rub will immediately stimulate the cytokines under your skin. A rub will also push the hair follicles back into the skin and can cause bumps or folliculitis. So you can manage this very well by just adopting a simple change to how you apply. So first of all, always wash your hands before applying emollients. And parents, this is even more important for children. I've had some recent really interesting research about development of food allergies, and a lot of food allergy develops through actually not necessarily through eating food, but through food substances being absorbed through the skin. And this is quite new research, but it has been known. So always wash your hands before applying to make sure there's no food on the skin, or traces of nuts or anything. So what you should do is you get a generous amount of emollient, you dot it on the arm, and if you look at the arrow, you're going to always be stroking it down in a nice downward stroke, and also applying it around the arm. So you might just see. So you do that for the whole body, but just dot, stroke, smooth on, downward stroke. And if you haven't been taught that, you'll find that could be quite revolutionary. I do feel sometimes small changes make huge differences. So as I say, bath or shower, we would always say when you have eczema, a daily emollient bath or shower is a good thing. There is some research going on at the moment, but my feeling is if skin is dry, if it's irritated, the microbiome means that you perhaps have more Staph aureus on your skin, and often an emollient bath or shower can be very soothing. It should be tepid and it shouldn't be for too long, and that's really important. And you should always use emollients when washing. A bath with plain water is not as good as a bath with emollients because plain water still will give a pH of about 7.5, whereas emollients will take your pH of your skin down to the ultimate pH of 5.5. You then would pat dry with a soft towel. And a really good tip, because emollients can be quite greasy, is just to put some boiling water down the plug hole once a week, just to make sure you get those drains just clear of grease and you don't get any blockage. Now, $1,000,001 question I'm always asked is when your eczema's flaring and you're needing to apply a topical treatment, what comes first? Is it the steroid or the emollient? It's kind of one of those holy grails of dermatology, I sometimes say. Now, I quite like people perhaps working very much on a bedtime routine when their eczema's flaring. One of the important things is because topical steroids should be applied once a day. And I always think it's much nicer and easier to apply at night because that's really going to settle the skin and hopefully help you or your child with a good night's sleep. So the most important thing is you don't stop using emollients when eczema flares. In fact, sometimes you need to use a lot more because the eczema is inflamed. You may even need to choose a different emollient in flares, but often once you found the one that suits you, you often stick with it. So if when you're treating an eczema flare, do have a bath and use the emollients in the bath. So basically, you are going to be applying your steroid to skin that's moisturized rather than dry and flaky. So pat dry with a towel, and then often you can see where the area of eczema is inflamed, and that's where you need to target the topical steroid because your emollients you don't have to target, but topical steroids you do. Then you should always have a gap. And there's been some recent research actually that says if you apply the emollient first, actually the gap should be much longer than if you apply the steroid first. So I personally would recommend in a flare the steroid first, wait 30 minutes, and then dot and stroke and apply the emollient on top. The most important thing is never mix topical treatments and emollients together. The steroids and emollients themselves are actually quite complex formulations, and mixing them together actually could make the formulation unstable, or sometimes can even increase the potency of the steroid, which is quite frightening. And talking of other safety aspects, one of the things that people are a little bit frightened about is that there is quite a big warning about fire risk. So you'll see on every emollient there's a stamp about emollients being flammable. Now, that's because nearly all emollients are paraffin-based. There are a few that aren't, but they would still be flammable. And we've always known that, but the risk stamp has now been added through discussion with the MRSH, so the medicals regulation authorities, which is really, really important. So the main thing is that don't let emollients be soaked up with cloves. So actually, if you have eczema and you're using emollients, you're probably going to need to change your cloves more regularly, or at least every day, because the fire risk is really if you've got clothing which has emollients soaked into it, and then if there is a source of a fire, so a match or smoking, or even candles. So I think don't have candles in the house if you have eczema or a child of eczema, and certainly don't sit by open fires. But generally, you do need the three ingredients for a fire risk. And generally, the risk is very, very low as long as you keep your clothes changed and they don't become grease soaked. Slipping is a problem. We have to be careful. So remember, if you use the spray on emollients, always put a towel on the floor first of all. Otherwise, they can be quite lethal on slippery floors. Use bath mats, etc. And again, try not to put fingers in tubs. That's why the pumps are very effective, because you don't need to put fingers in. And if you do have a tub of ointment, it's a good idea to get into a habit of scooping it out with a spoon before applying it. So when emollients on prescription should be there, absolutely there. Children with eczema should be prescribed emollients, no question. Probably older people as well. But at working adults, it's a little bit tricky, because sometimes the emollient can be cheaper to buy over the counter than the prescription charge. Although saying that, the prepayment prescription, if you have severe eczema, is really worth getting. So that's when you pay for all your prescriptions in a 3, 6 or year period, and you can have as much prescription item as you like. So certainly with eczema being a chronic condition, you need to have enough. And by enough, we do say 500 grams a week, because you're going to be using them for emollients, those emollients for applying and washing. And remember, even though bath oils and washes have their place perhaps, they're often not on formularies and often no longer prescribed. So that might be a choice if you feel a bath oil or a wash really is effective for you. And if it's effective for you and it stops your eczema flaring, it's worth having a conversation as well with your GP and saying, look, this has made a difference for me. But if you haven't used bath oils and washes, and you're quite new to eczema, or your child is, we really try and get people to work on using the emollient for a wash. So we've got lots of time for questions now. We've got 20 minutes. So thank you for joining. And Eleanor is now going to feed me some questions. And, we'll see how many we can get through, really. But I do hope it's been useful. It's quite a broad subject. And, I think there's quite a lot of complexity in my presentation, because I think it's really important. Emollients, I think my summary is, emollients are not nice to have. They're essential to have for eczema, and they will help also prevent flares as well. And also, hopefully expand the time in between flares if you do use them every day and find the right one for you. So over to you now and the questions.
Brilliant, Julie. Thank you so much for your informative presentation there. That was incredibly useful. So we've had a few questions in already, but feel free to continue to submit questions to us, and we'll answer them as we go. The first question is, if you get a bad reaction after the first couple of times trying a new emollient, should you stop using it immediately, or how long should you persist for? So what would be the recommended time to move on?
Well, I think emollients are very individual. I always say what suits one doesn't suit another. Sometimes this can be an irritancy, rarely, but occasionally it can even be a contact allergy. So I think if it's really irritating and not suiting you, yes, I would change to something else. It doesn't mean you're allergic. It perhaps means there are some ingredients which perhaps are irritating, and sometimes we don't know quite what that is. Um, so I think if it has been irritating for a few days, I would definitely move on. But unless your eczema's flaring, because if your eczema's flaring, sometimes you need to sort of wait wait for the flare. And that's why in some ways sometimes it's quite good to have a couple of emollients that you like to use. But if you can find one that suits for everything, that's good as well. So yeah, I would try something else. There's a wealth available, and you might find that another formulation, another brand suits you a lot better.
Brilliant. And building on that, emollients are very expensive. One of our audience members was asking if there was a way to be able to get some samples, so they can try different ones without spending a lot of money.
I think that's a great idea and absolutely agree 100%. Certainly, with one of my clinical jobs, it was great. I had a big yellow bag and I had it filled with lots of samples from companies. And I'd talk about formulations and I give people emollients to try. I try and encourage that with the healthcare professionals I teach, but they often say they're not necessarily allowed to give out samples anymore, which is a shame in a way because it's just so useful. I mean, it's sometimes you now it's quite interesting because if you wanted to, it's a slightly different note, but if you wanted to say try different sunscreens to find the one that suits you, you'll often find there are little travel sizes and tester sizes of sunscreens. But you do sometimes find that with emollients as well. So I think if you go to a bigger pharmacist store, you might find, smaller amounts, but then, that still could be expensive. It's possible to ask your healthcare professional or your pharmacist. Your pharmacist might have samples, your healthcare professional might have samples to give. So ask them. I mean, if you really felt, gosh, I really want to try X emollient, but I don't want to buy a big pot, you could even contact the customer care lines of the emollient companies. I'm not quite sure how often they would send out samples, but they're not medicines. Some can be medical devices, and a lot are not medicines. So it's possible you could get some samples that way, but I couldn't promise for everything. So I think if your healthcare professional can help you with some samples, and it is such a good idea. And in some ways, I think in every dermatology or eczema clinic, it almost should be something that is offered to patients.
Absolutely. You spoke a lot about using emollients when washing, so in the bath or in the shower. Um, we've got a question about recommendations for shampoo because that's quite different to using a shower gel. Will the emollients be as effective at cleaning hair as a normal shampoo would?
Yeah, no, that's a great question. I'm glad you asked it. The problem is that most shampoos by the nature contain detergent. So one thing perhaps we should add on is that it's a real pain, but if you do have more moderate to severe eczema, it's probably a good idea, and perhaps it's easier with children not to wash hair within a bath or a shower. So try and wash your hair separately. Obviously, if you have scalp eczema, that's quite tricky. The lotion form actually can work quite well as a shampoo, and there are some brands that do produce shampoo as well. You can sometimes buy shampoos without detergent in as well, but they tend to be on the quite expensive side. And then if it doesn't suit you, it's expensive. So you can wash your hair in an emollient, but probably the lotion's better, but it will still leave your hair a little bit greasy. So I think if you haven't got scalp eczema, probably the best advice is to try and wash your hair separately, because otherwise you wash it in the shampoo and all the detergent just runs onto your body basically, and then you go 3 steps forwards, 5 steps back because you've had that input of detergent. But it is quite tricky really.
Yeah, thank you. We've got a question here saying, I see so many adverts for the miracle ointments on social media. Are there any you can recommend?
Well, it's very difficult. There are lots of input about, we sometimes call them dream creams, actually, the Eczema Society. The huge problem with social media is you don't know what the regulation of these products are. So with the medical emollients, yes, they may be produced by quite big companies, but what you know for sure is that there's very good quality control and regulation. It's quite scary that somebody could maybe produce a small amount of something that they may call, a wonder emollient, and they're producing it in a way that is not regulated or safe as it would be in a factory. We just don't know. So I think you need to find out more about the actual company and how they make their product. You also need to make sure that they don't contain any fragrances or any ingredients that will irritate, and sometimes that might be hidden. Um, you need to probably consider, perhaps why you want to buy something from the internet. Is it because you haven't been given a range of what's available? Because hopefully there should be one to suit everyone. Another practical thing is they often cost an awful lot of money, because if you're planning on or trying to achieve 500 grams a week to moisturize your skin, and something that you buy over the internet only comes as a 20-gram pot, it's not going to be an effective moisturizer, but just because you won't be able to use enough. The other thing that's quite worrying is there are some products, some real rogue products on the internet that say they're natural creams or even natural emollient creams. They could come from anywhere, and they do actually have hidden steroids in them, which is even worse. So I'm quite skeptical sometimes about sort of quite obscure products on social media. I think if you can do your research and explore where they come from, how they're made, and try and get in the ingredients lists, yes, of course you can make your choice, because people should have choice. But I also feel there is a big enough range of the medical emollients to perhaps choose from, which we know will be safe in terms of how they've been produced. They may not suit your skin, but they're going to be safe in terms of quality control. So it is tricky.
Brilliant. We have a question here who someone's saying they're more looking for a recommendation. But they say, how do you apply your, sorry, if you have to apply your emollient regularly, but you feel you have allergens on your skin, such as pollen or dust, when it's not always possible to clean your skin first, how should you go about applying during the day if that's the case?
Oh gosh, that's quite a tricky question. I mean, obviously, dust mite is not going to sit on your skin as such, because you're actually allergic to the dust mite droppings within your beddings or your furnishings. Um, Pollen, I mean, if it's a very high pollen day and you're allergic to pollen, I would say you probably do need to have an emollient shower or bath before you apply, because sometimes it can stick to your skin. Um, but then, to be honest, you can have more than one shower a day if you need to in high pollen count days. As long as you're using your emollient, that's absolutely fine. There has been a long running myth about bathing ever since I've been in dermatology. Actually, you sometimes get the myth, oh, you shouldn't really bathe very much when you have eczema, and that goes back really to people using soap and bubble bath. But if you use an emollient, and if your skin's irritated, or if you feel it's a day where allergens are particularly problematic, I probably would just have another emollient shower when you've been out before you apply, because you're right, you don't want to apply emollients on top of pollen that may be on your skin. But generally, pollen's airborne as well. I don't think it necessarily hovers and sticks on your skin. But as I say, that might be one way of dealing with it.
Yeah, so perhaps using a thicker humectant cream and then waiting to shower at the end of the day and going from there.
Yes, yeah, that's the other
Fabulous.
thing. Yeah, humectant lasts a bit longer. So if you're using a simple cream, you might be better to consider in the morning before you're exposed to allergens to use a humectant cream, because it will last longer and you won't have to reapply it. That's a good point, Helena. Thank you.
Perfect. We've got someone here who has said they have eczema symptoms on their eyelids, but all the emollients they've used are causing irritation. Is there anything you can recommend?
Yeah, it's a tricky area, eyelids. It tends to be very sensitive, and the reason is it's the thinnest area of skin on the body. Um, a very thin area of skin. Um, it is tricky because you've got to try and find an emollient that might suit. I think if the eyelids are very irritant, you might even be better to use a slightly greasy ointment, but you might not want to use that in the day. So maybe actually just gently putting ointment on at night, maybe sleeping with an eye mask, and then maybe that will help. I mean, if your eyelids are very irritated, though, it might be that the emollient is irritated because the eczema is flaring, and you may need to consider, treating your eyelids, because the thing is that emollients are not going to necessarily, when skin is flaring, actually treat an eczema flare. So sometimes it is difficult. It's difficult. Didn't really want to talk in brands, but there's one emollient where you're recommended not to use it on your eyelids. So I probably ought to say what that is, which is called Epimax ointment. But conversely, the same company has now produced a different emollient with different ingredients that is suitable for eyelids. I don't think you necessarily need eyelid eczema, but I would say that the one emollient you shouldn't use on your eyelids and around your eyes, because we have got guidance again from the MRHA, is Epimax ointment. I'm not necessarily singling that out, but there is an ingredient that's seen to affect the eyes. But as you say, that the eyelid ointment they produce is not the same, so it's probably good to just share that.
Brilliant. What kind of emollient would you recommend for swimming? A thicker or a thinner, for adults and children?
Yeah, that's a really good question, actually. It probably is a time when a thicker ointment might be better. As I say, we don't want to go into a pool very greasy, but if you think about it, you need a protective barrier. So yeah, probably would recommend more of a greasier ointment for swimming. Again, you could use something like I don't want to point out brands necessarily, but Epidermal Hydromol, which is more of a waxy grease, so you can sort of just put that on in a sheen, slip into the pool. Hopefully, that will be fine. It's not going to affect anybody else swimming or the water. Another thing about swimming is that often the chlorine, interestingly, is not often the culprit to irritation when you swim, because actually chlorine is a bleach. And there has been some discussion about possible using bleach as a treatment, which we don't do regularly, but there is a possibility. So it's often the other chemicals. So if the pool sort of smells quite chemical-like and it's quite strong, or it makes your eyes slightly stingy, maybe move to a different pool, because the chemical mixes are very slightly, subtly different. The other thing is, remember, the shower water often contains the same chemicals as the pool water because it's a public shower. So if you can, when you've been swimming, try just to go straight home and pop into your own emollient bath or shower, so you're not getting any irritation from the water from the actual showers. But please swim. Please take your children swimming. Often children with eczema actually really enjoy swimming, and often it's not too detrimental to the skin, but everybody is different, of course. But swimming is a really important life skill.
Brilliant. Now we've got a question here about no moisture treatment, which relates to the field of topical steroid withdrawal, which obviously we know there's no specific guidance on this yet, but I feel like it's quite important that we try to answer this question. So the question is, I'm currently in topical steroid withdrawal and have heard of lots of conversation around NMT, or no moisture treatment. If we are supposed to be moisturising skin to fix the brick wall effect, why would this be recommended?
Yeah, I think it's a great question, and thank you so much for asking it. And I'm sorry of what you're going through. It's really tricky because even though it is a recommended within a sort of topical steroid withdrawal recommendations for treatment, I would say that there just isn't any medical evidence about not using moisturizer. And in fact, I've met quite a few people who are going through topical steroid withdrawal, and actually two of the people I met said actually the one thing they wouldn't do was stop using moisturizing. But then for some people, it, it is said that it helps them. Um, Personally, I just can't quite get my head around it really, because as I say, if we're using moisturizers to repair the skin barrier and give people longer time in between eczema flares, and maybe shortening the amount of steroids they use to control their skin, to my mind, it seems to fit quite well to use moisturizers when you're going through topical steroid withdrawal. That certainly is, what I would think. And I would think that in that way, it might be more helpful to use moisturizers than not, because the problem is if you don't use moisturizers, your skin's going to get very dry, very sore. You're going to want to scratch it more. It's going to be really tough because skin is painful anyway, and you haven't got anything to really help soothe your skin, and emollients are so soothing as well. And you could also get cracks and fissures. It could be a portal for infection as well. So it's difficult to see how it may be advantageous, particularly if you've got severe eczema, and you have a filaggrin deficit. As I say, we always feel moisturizers are first line and should be for any situation of eczema. So it's obviously up to you if you try it and it helps. But personally, I wouldn't probably recommend no moisture therapy.
Brilliant. Thank you, Julie. Someone here has asked about antihistamines. I know there are several types of antihistamines, such as cetrazine and hydrochloride. Is there one that alleviates eczema symptoms better than others?
Again, if they're non-sedating antihistamines, fexofenadine, cetracide, there's just not much point using it. There really isn't any place for non-sedating antihistamines, because basically eczema isn't histamine driven. Whereas if you have a condition called urticaria or hives, there might be a place for them, and then it probably would be managed by somebody in dermatology. And again, you could speak to a GP or healthcare professional with experience. We sometimes use sedating antihistamines purely to help with sleep, and mainly for children. So, a lot of people get prescribed antihistamines and feel they help symptoms, but as I say, the histamine pathway is there in eczema, but it's a much lesser pathway than urticaria. So the feeling is that non-sedating antihistamines, it's the emollients that will help control the itch a lot better.
Thank you. And we're going to go in with our final question now before you wrap up. Shaving always irritates my eczema. Do you have any tips for how to make this less of an issue?
Yes, it is. Shaving is difficult because it can be quite harsh, and it can strip your skin. So I'd always say make sure you're well moisturized. I'm not sure if you're talking about facial shaving or shaving body hair elsewhere. So I'd also, it's also quite a good idea maybe to use your emollient for shaving, and particularly this is where a lotion might be quite helpful. A lot of shaving foams or shaving products again contain detergent, or particularly contain perfumes. So it would be quite a good idea to maybe use your emollient to shave with as well, and then use the emollient well afterwards as well.
That's great. Brilliant. Well, that wraps us up for today. Thank you, Julie, for such an informative and useful webinar. Thanks to everyone who joined today. If you're new to the eczema community, welcome. It's been great to host you. Managing your eczema and finding the right emollients can be difficult at times, but we hope we've been able to provide some useful information and guidance. We have a number of downloadable fact sheets on emollients and many other topics on our website, so that's eczema.org. to support you through your eczema management. But I want to thank you all again for joining and to let you know that we are featuring a number of topics in our Exploring Eczema webinar series. The next one will be on managing eczema in school-age children, and these will be on Monday the 18th of November and Thursday the 21st of November. Registration is live on our website now, so if you head to our webinars page, you'll find the information about other topics and how to register there. We look forward to hosting you next time. Thanks, Julie.
Thank you, everybody, for joining.